Hi, everybody. I am Elizabeth Simmons,
And I'm Kara Vandegrift.
and we are the co-founders of the National Doula Network and are very excited to tell you about our initiative to increase access to birth doula services to advance equitable maternal health outcomes.
As a proud alumni of the Department of Maternal and Child Health at UNC, I can say that we are deeply honored to have been selected by this year's committee to share our innovation with you and all the attendees at the inaugural National Maternal Health Innovation Symposium. Thank you to the Maternal Health Learning and Innovation Center for this opportunity and for hosting such an important event.
The National Doula Network is a growing network of doulas committed to serving, supporting, and centering birthing people in their communities throughout pregnancy, birth, and postpartum. Our mission is to increase access to insurance-covered birth doula services. Doulas are professionally trained support people who specialize in providing social, emotional, and physical support before, during, and after childbirth. Doulas exist outside of medical and clinical professions and do not receive any formal medical training. They are unique in the support they provide, and they do not duplicate or replicate or replace medical care or any other clinical services provided. The relationship and bond forged between a doula and a client is intimate, collaborative, familial, and unique to them.
As for our story, Elizabeth and I met in 2017 and instantly bonded over our mutual interests and commitment to centering women in their perinatal care and improving maternal health outcomes. We combined our mutual interests and began working on a couple of local provider-focused initiatives. In 2019, our work led us to a collaborative conversation with United Healthcare, and we learned of their desire to offer birth doula services to their members as a part of the Florida Medicaid expanded benefits.
Through our conversations with United Healthcare and a host of national and community partners, we learned of the unmet need for doulas in Florida to receive living wage reimbursement for their services and for women in those communities to have full access to these expanded benefits. The Agency for Healthcare Administration in Florida had not yet released guidance to the health plans about how the benefit was to be implemented, and this valuable benefit was going significantly unutilized. At this time, we were closely following the conversations around Medicaid reimbursement for birth doula services in other states and wondered if there was a way we could support the expansion of doula services differently. We are both doulas and have dedicated our careers to supporting local community-based maternal health projects and have deep roots in developing collaborative partnerships. My extensive experience is working alongside health plans, and Kara's career is focused on scaling community-based health initiatives. So together we developed a proposal that we submitted to United Healthcare to work with them to develop Florida's first doula provider network. The opportunity felt like a culmination of both of our lives' works, and together we launched the initiative just over 1 year ago.
So during today's presentation, we will share a brief summary about our network, how we got started, our goals for launching the program, learnings and accomplishments so far, and then we'll highlight a few of our immediate next steps. So we began this work in September of 2019, and to get started, it all felt a little bit messy. We took a lot of notes, we were learning a lot with each other and alongside United Healthcare, as we built something that had really never been built before. There were several months of planning and conversations that went into the launch of the network prior to the start of our contract in April of this year. As we began to build the network, we kept a few key objectives in mind. First, we were committed to building a network that was rooted in collaboration and one that engaged doulas, community agencies, state agencies, research partners, and national entities, as well as health plans and other key stakeholders in our planning conversations to support the program's effectiveness, sustainability, and success. We are new, and we honor that many in this field have been doing this work for much longer. We have a lot to learn, and we want others' experiences and voices at the table with us.
Our second objective was focused on meeting the doulas where they are to provide administrative support and the support the doulas needed to best serve clients and their communities. Health plans were aware of the need to offer the expanded benefits, but they had not yet built the systems for doulas to submit the claims and efficiently be reimbursed. So we sought to develop a straightforward system to support doulas by providing administrative support, such as credentialing, access for documentation software, negotiating and establishing billing codes, and a fee schedule to support a living wage. Like any provider with back office billing support, doulas deserve to be supported and competitively reimbursed and relieved from that burdensome process of navigating insurance claims and billing. And that way they can really focus on the best needs of their clients.
So we focused on creating a community-centered doula provider network that ensures doulas in their communities have the administrative support and also providing a network that increases opportunities for peer-to-peer collaboration, as well as opportunities for professional growth and learning, supervision, mentorship, and connection to local community resources. We currently add a layer of interdisciplinary support through the health plan's case management teams so that doulas also have the support needed to manage more complex situations with clients if needed. So for example, we recently had a client who was admitted to the hospital for poorly managed gestational diabetes, and the doula contacted us immediately after her client's admission. The client was a single mother with 2 young children at home and no family support nearby to care for her children. The hospital was recommending that she be admitted for the remaining 3 months of her pregnancy. The client was scared. She didn't know how her children would be taken care of. And so we worked together with the doula and the health plan to identify an at-home diabetes home health management program that they had available that was covered through her benefits. So through our collaborative efforts, the client was discharged from the hospital, able to remain at home with her 2 young children for the remainder of her pregnancy. The doula is able to continue providing that support at home, and the healthcare cost savings are nearly unimaginable, and the risks mitigated from keeping that client at home versus being in the hospital for 3 months are significant. We really work together with that interdisciplinary team of case managers to ensure that doulas have the support they need to best support their clients. So with our focus on national conversations around Medicaid reimbursements for doula services, our third aim was to combine our learnings from the literature and the research on the benefits of birth doula support with bringing those recommendations into practice and ultimately learning from the lessons learned and missteps in other state initiatives. We adopted many of the key recommendations that we identified in the literature for supporting doulas and remain focused on continuing to implement additional recommendations as we grow and scale. There are many documented benefits of doula support to improve birth equity and maternal and infant health outcomes. However, through our conversations, we learned that many in the medical community and within health plans are not as aware of these benefits. So we develop tools and resources for providers and health plans and the broader community to increase awareness of birth doula services and this Medicaid covered benefit that was available in Florida.
Which leads nicely to our 4th objective, which is to ensure that pregnant individuals with Medicaid have access to the birth doula services within their own community. So to reach those communities, we held regional convenings for birth workers, we've built partnerships with providers, and making sure that the clients are being directly referred to doulas in their area. Many of the clients we serve were completely unfamiliar with doula services, and during the initial intake process, they've expressed having very limited or often no social support for these pregnancies. So in many cases, in some cases, I guess, having a doula supported birth has really been life-changing. In our initial phase of the program with UHC, we focused on serving high-risk pregnancies with behavioral, mental health, or substance use diagnoses. And by serving that smaller population to start, we were really able to focus on developing our systems, fine-tuning our processes, so that we're ready to roll this benefit out to other health plans and a larger population of Medicaid enrollees.
So after our contract went live on April 1st of this year, with the onset of COVID-19, we added a 5th objective to improve doula access in hospitals and within the medical community. So throughout the pandemic, hospitals have adjusted their policies to either allow or exclude doulas from entering facilities with their clients. Many of these policies classify doulas as visitors instead of trained birth professionals providing a valuable benefit to their clients. This disparity in care existed prior to the pandemic, but has been exacerbated in recent months. We are engaging in broader communication directly with hospital facilities to ensure that women have access to this insurance-covered benefit that they're entitled to. ACOG, A1, March of Dimes, and several others have all released statements in support of doula services. And we've really leveraged these resources in addition to the academic literature to develop tools for providers to increase awareness within the medical community and highlight the scope of services that doulas provide.
We, over the last 6 months, a year since we really started, but 6 months of program, we've had a lot of accomplishments. First, we've removed significant barriers to benefit utilization for doulas. Some of the ways we've done that is by developing the service and building the network is the big one. Secondly, we've removed requirements for prior authorization, age restrictions, and we've allowed telehealth for prenatal and postpartum visits. Third, we've ensured that doula support is available for home birth, birth center, or hospital birth when it's attended by an in-network medical care provider. Some other accomplishments is we built a really solid network of doulas that is growing, and Kara and I routinely lean on them for all of their expertise within their communities. We've worked hard to develop strong partnerships with key stakeholders, providers, and word is spreading within the communities across the state that this is a benefit that these women can access. We are directly working with the state to develop billing codes and to support a standard scope of care for doula services. We've also, really exciting, built a system for doula reimbursement that works. So claims are processed and doulas are paid. And our last accomplishment I want to highlight is that we've just recently added 2 additional health plans that we will begin working with on October 1.
So this work has not been without its significant challenges as well. So while we started this initiative with an informed idea of what was missing and what was needed to support doulas in their communities, we've been reminded throughout our journey that there is no one-size-fits-all approach, and we continue to remain open to continuous improvement, collaboration, and really pivoting our approach as needed. Second, launching a new program in the middle of a global pandemic is hard. We never could have anticipated starting this work in this way or meeting some of the challenges that the virus has posed for doulas in their communities. So for example, the racial disparities in maternal health care have been exacerbated by the pandemic, especially as hospitals implement more restrictive policies to prohibit doula support by forcing many women to birth alone or without the birth support they need or thought that they would have present. We are determined to supporting doulas and our clients by advocating for access to hospitals and birthing centers to ensure that clients receive the support that they need and deserve and that they get the benefits that they're entitled to. Doulas are providing more virtual support for prenatal and postpartum visits, and we really had to work with the health plans to be willing to provide this reimbursement for these services. Prior to the pandemic, we also anticipated more in-person convenings and regional community building with doulas. However, we're having to rethink this plan and execute more engagement virtually. For all of us, the virus is continuing to cause us to think differently about how we do business and how we're building community relationships. An additional challenge of this approach was that not all doulas receive training to support high-risk populations with other social determinants. So we are providing direct support and consultation for the doulas to meet the needs of their clients, and again, working with that interdisciplinary team if and when needed. So this is an area that we're continuing to focus on and develop in year 2.
We really have built some amazing, strong relationships with the doulas in the communities across Florida. And one of the doulas we work with, Tasha, had this to say recently. She said that the National Doula Network on the back end of the operation are very hands-on and supportive in making sure everything is submitted to UHC Medicaid correctly, which is great because I can just focus on supporting the birthing person.
And another recent applicant in the program shared this statement. She said, "I'm grateful to you and appreciate all of your hard work to make our community a much better place and being a force to drive society towards having birth equity." So this is our goal for creating this. So in terms of our immediate next steps, again, we've been doing this for a year and actively for just about 5 or 6 months. So we are working with Race for Equity to ensure that data drives our decision-making. We're enhancing our focus on birth equity and developing our strategic plan for year 2 and beyond. We are in the process of gathering and integrating early feedback from doulas, providers, members, health plans, so that we can continue to build on the successes from last year. And we're increasing opportunities for training and development to better support doulas with providing culturally appropriate, culturally congruent, or trauma-informed care so that they can address the social determinants of health that may be impacting their client's perinatal journey.
A couple other next steps that we're doing is that we're engaged in conversations with new health plans, and I look forward to expanding the network soon to engage in other Medicaid regions in Florida as well as other states. We continue to grow the network of doulas to best serve the individuals in their communities. And finally, we are really focused on enhancing the accessibility and sustainability of our services for doulas and health plan members. So many, many, many more can benefit from these services.
So thank you all for tuning in to today's session, and we hope that you enjoy the rest of this year's symposium. Please feel free to contact us with any questions, and thanks and have a great day.
Yeah, thank you. Bye.
Bye.